great philosophers have encouraged us to venture on the lesser-known path, it may not always be a good idea, especially if it's harming your health. What are we talking about? We are talking about fistula, commonly called bhagandar, where an abnormal communicating tract develops between the last part of the intestine and the skin outside. Let's get to the bottom of fistula. The anal canal is the last part of the intestine which helps in expulsion of feces. Just inside the anus, there are a number of anal glands that secrete a fluid that facilitates easy passage of stool. Sometimes, these glands can get blocked and infected, leading to the formation of a swollen pocket of infection, or what we call abscess. If this abscess is not treated in time, it grows and makes its way to the outside by punching a hole in the skin near the anus, which is called external opening. To sum it up, fistula is the tunnel that connects the rectum or anal canal to an unwanted opening in the skin. A fistula can cause agony and discomfort to the patient in the form of throbbing pain, difficulty in sitting, swelling and irritation around the anus, and foul smell due to discharge of blood or pus. Many find themselves incapacitated to live a normal life. Fistula is an anatomical and structural problem, and it cannot be cured with medication, so surgery is the only way to cure the fistula. A simple fistula can be treated by various surgical options, including fistulectomy, with good results. In a complex fistula, where the sphincter muscle is involved, FILAC is a good way of treating it. In FILAC, the laser fiber is inserted into the fistula tract. This fiber circumferentially emits a defined amount of laser energy that causes controlled photothermal destruction of the tract. But the real challenge is in treating complex fistula, and that is where Dr. Ashwin Porwal's innovative DLPL surgery and BEST device gives exceptional results. Most of the conventional surgeries for complex fistula are associated with a high recurrence rate, prolonged recovery time, and carry the risk of incontinence as well. The aim of treating complex fistula is to prevent a recurrence without damaging the sphincter muscles. This is where Distal Laser Proximal Ligation, or DLPL, comes into the picture. This ingenious technique was developed by Dr. Porwal himself with his years of experience, knowledge, and in-depth study of the condition. Dr. Ashwin Porwal, proctologist and founder of Healing Hands Clinic, has done extensive work in treating anorectal conditions, having treated more than 7,000 complex fistulas with DLPL technique with a whopping 99% success rate. These cases include recurrent fistula, scrotal fistula, inguino-abdominal fistula, urethral fistula, tailbone fistula, horseshoe fistula, knee fistula, extrasphincteric fistula, hip fistula. It includes more than 2,000 cases of complex type 4 fistula. Dr. Ashwin Porwal's DLPL surgery is performed under the guidance of 3D endo-anal imaging in real time to obtain assured results. Even side tracts, branches, and hidden abscesses can be accurately identified on 3D imaging. In this procedure, an abscess that is present is first drained and then debrided. Then, the distal tract is destroyed using laser energy. Finally, the proximal portion of the tract is either closed with suture or at times kept open for drainage. External opening is made wide to allow drainage and prevent collection. Eventually, the fistula wound heals in 6 to 8 weeks of time. The internal opening heals in 3 weeks, and the tract heals in 6 to 8 weeks. The key to success is timely follow-ups, which varies from case to case. The advantages of DLPL include an astonishing 99% success rate, a study of which was published in international journals. Besides, DLPL gives excellent results in cases of complex fistula associated with Crohn's and ulcerative colitis. Dr. Ashwin Porwal has also developed a minimally invasive procedure for rectovaginal fistula with excellent success rate. On similar lines, he has developed a new technique for urethral fistula. His technique of DLPL has got published in international journals and has also been presented in various international conferences. DLPL offers assured results in complex and recurrent fistula. People from far and wide, some having suffered from this condition for years together, have found cure with DLPL. With more than 7,000 feedbacks, Healing Hands Clinic has a rating of 4.9 on Google.